Well, good morning, and at the outset, let me thank Executive Director Julius Wool and everyone at Queens Hospital Center for hosting us today. Because of the dedicated health professionals here and at other public and voluntary hospitals across the city, as well as the very effective public health policies overseen by Dr. Tom Farley and his team at the city's health department, New Yorkers are living longer, healthier lives than ever. Our average life expectancy is 3 years longer than it was in 2001 and more than 2 years longer than it is nationwide. But there is still more that we can do. We've come here today to announce the latest steps we're taking to reduce what remains a persistent health risk, especially for our city's young people. We're proposing 2 new city laws, one of which would be the first of its kind in the United States, aimed at reducing still further what remains one of the leading causes of preventable death in our city, and that is smoking. These laws would protect New Yorkers, especially the young and impressionable New Yorkers, from pricing, discounts, and exposure to in-store displays that promote tobacco products whose use is addictive and whose consequences can be deadly. I'll say a bit about the specifics of these new laws in a few moments, but first let me talk a little bit about why they are needed. We're very proud of the progress we've made in reducing smoking among all New Yorkers, young and old. Health Department surveys show that smoking among adult New Yorkers has decreased by 31% since 2002, and smoking among teenagers has also dropped dramatically. During the 10 years between 2001 and 2011, we also cut the proportion of public high school students who smoke by more than half, from 18% to 8.5%. It is good news. Nationwide, by comparison to those numbers, about 18% of high school students smoke. However, the decline in youth smoking in our city has stalled out, and as this chart right here shows, it has remained at roughly the 8.5% level since 2007. And that means that currently about 19,000 New York City public high school students under the age of 18 smoke. Health surveys also show that some 28,000 students first tried smoking during 2011, the last year for which such data is available. And studies of addiction tell us that symptoms of tobacco dependence can begin very soon after a young person first tries smoking. So we're asking the City Council to help us address this problem by passing 2 new laws. Councilwoman Maria del Carmen Arroyo, the chair of the Council's Health Committee, well, I'm happy to say introduced them at the next Council meeting on Wednesday. First, we're proposing legislation that would prohibit display of tobacco products in most retail establishments. The reason? Such displays suggest that smoking is a normal activity and they invite young people to experiment with tobacco. This is not a normal activity, and experimenting when you have something that's addictive is the first step to being addicted, and the first step to being shortening your life and making your quality of life worse. Under our proposed tobacco products display restriction law, which would be the first of its kind in the nation, cigarettes and other tobacco products would have to be stored out of sight, in cabinets, drawers, and under the counter, behind a curtain, or concealed in some other way. Stores would still be free to advertise tobacco products and post price information. Stores devoted primarily to the sale of tobacco products are exempt from the rule, but young people under the age of 18 are already prohibited from entering such stores without a parent or a guardian. Now, we know that out of sight doesn't always mean out of mind, but in many cases it can, and we think this measure will help reduce impulse purchases. And if it does, it will literally save lives. The second proposed law that will be introduced on Wednesday is called the Sensible Tobacco Enforcement Bill. It addresses the persistent problem of the widespread availability of discounted and smuggled cigarettes into our city. Sales of smuggled cigarettes are a particular problem here, where a combination of state, city, and federal taxes has made the price of cigarettes the highest in the nation. What that does is it makes it much more difficult for kids to get cigarettes. It is the single biggest thing you can do to reduce teenage smoking, is raising the prices through tobacco taxes. But having said that, it is also a reason why people would try to avoid those taxes, why unscrupulous people would like to buy cigarettes elsewhere without paying tax and then resell them in sort of a black market here in the city. This second law would prohibit the sale of discounted tobacco products, establish a minimum price for cigarettes and mini cigars, impose new packaging requirements on cheap cigars and cigarillos in order to keep them from being sold individually, and increase penalties for retailers who evade tobacco taxes or sell tobacco tobacco products without a license. The big goal of these pricing and enforcement measures is stopping young people from smoking. We think they'll be effective because high prices, as I said, tend to discourage young people from smoking. The new law would also level the playing field for the vast majority of merchants who respect the law and who now have to compete unfairly with those who don't. And it will stop the illegal cigarette sales that cost New York City about $30 million in lost tax revenue every year. People always say, oh, you're doing these health things to raise money. No, that's not the reason. We're doing the health things to save lives. But if we are owed money, we have a responsibility and an obligation to try to collect that money, because that's the money that goes to pay our teachers and nurses and firefighters and sanitation workers and cops. This is a big thing. Make no mistake, the primary purpose is to keep young people from getting hooked on a habit that is likely to ruin their health or even end their lives at an early age. So let me now ask our City Health Commissioner, Dr. Tom Farley, for his comments on these new proposed laws. Tom?
Thank you, Mayor. First, before I talk about the bills themselves, I just want to remind everybody that tobacco is an addictive drug that still kills several times more Americans than heroin, cocaine, crack, crystal meth, and all the other illegal drugs combined. In fact, tobacco, when used as it's intended by its manufacturers, kills about a third of the people who use it. And that means that tobacco companies have to constantly get new young people hooked to their product in order to replace the customers who have died. Now, the city is known for its leadership in protecting our young people from smoking. But as the mayor pointed out, our progress in the last few years has stalled. There are two reasons for that. It has to do with pricing, and it has to do with display of cigarette products. And these bills address those two problems. So let me talk about the pricing one first. The single most effective thing we can do to get kids to not smoke is to have a high price for cigarettes. That's because teens tend not to have cash in their pocket to easily buy a pack of cigarettes. As the mayor pointed out, here in New York City we have the highest price for cigarettes in the nation with our combined city, state, and federal taxes. But that high price is routinely undermined in several ways. First, it's undermined by tax evasion, by people who buy cigarettes illegally, either they're counterfeit or in low tax states or in Indian reservations, then resell them to stores here in New York City who are then sold to customers. It's also, the prices are undermined by discounting. Manufacturers have coupons for discounting. They have deals like buy one, get one free. And they have discounted specials. And third, they package tobacco in ways to evade taxes. Through little cigars, for example. Right now, you can buy a pack of 20 little cigars that look for all the world like cigarettes, except that they have a brown wrapper instead of a white wrapper, for about half the price of a pack of cigarettes. So the sensible tobacco enforcement bill addresses all of those issues with stronger enforcement, an end to discounting, and packaging and pricing regulations. It's the most comprehensive approach anywhere to prohibit cheap tobacco from getting our kids hooked. Now let me talk about the display issue. When teenagers go to a bodega or a drugstore to buy a carton of milk, they're confronted with a display of cigarette packs behind the cash register. We've all seen that. Study shows that those have an effect. The more those kids see those cigarettes, the more they view smoking as normal and acceptable, the more likely they are to start smoking. In fact, that exposure can be more influential in getting kids to start smoking than having their parents smoke. Now, this has been an issue around the world, and other countries have begun to address this. Right now, in Canada, Ireland, Australia, New Zealand, England, and other countries, they have rules in place that prohibit retailers from displaying packs of cigarettes so people don't get that exposure. The retailers put those cigarettes in drawers or cabinets or behind curtains. In Canada, where it's been in place for a number of years, where it's been evaluated the best, after they put this display ban in place, we've seen a significant reduction in teen smoking. So overall, we need these two bills to protect our kids from getting enticed into using the world's most dangerous drug. I want to thank the council members, Councilmember Gennaro, Councilmember Levin, who are going to be here, he'll be here in a minute, today for supporting this bill. We look forward to working with the council and getting it passed and seeing it become law. Thank you.
Tom, thank you. And now City Finance Commissioner David Frankel, who plays a big part in implementing rules like this and will be the biggest, one of the biggest implementors, if you will, of new tobacco enforcement measures. David?
Over the past 18 months, the Department of Finance, through its Sheriff's Office, has conducted over 1,900 inspections of retail establishments. In 46% of those cases, we found that retailers were selling either untaxed, unstamped, or phony stamped cigarettes. 46% of the cases. This does two things. Number one, it lowers the price of cigarettes, again enticing young people to start or continue smoking. And number two, it's terribly unfair to retail establishments who are following the law. Right? Tobacco is not illegal. No one's looking to make it illegal. We are looking to level the playing field for all our businesses in the city, and we will continue to do that. We have made over 230 arrests, 20 of which have been felony arrests. And what we are looking to do in this particular bill is to give the department and the Sheriff's Office power to shutter those establishments who have had 2 or more violations, I think over a period of 2 years. This is just one part of a campaign that's going to make it much more tough for people to evade the law. We already have the highest state and city combined cigarette tax in the country. I think it's $5.85. But even that is not stopping this proliferation. And if you talk to our sheriff, who's here today, he will tell you the incredibly ingenious ways that retail establishments go about hiding the cigarettes that are untaxed. That's what we're looking to do. In the city, we also have the New York City Law Department, who is using ingenious and new ways to bring lawsuits against various establishments for evading the tax. And all together, Dr. Farley and the mayor and I and others are doing a job to make sure that this doesn't keep on happening. Thank you.
David, thank you. The community we're in is represented very effectively on the City Council by Councilman James Gennaro. Jim, you want to
Thank you. Yeah. Thank you very much, Mr. Mayor, for your leadership. This is but the most recent effort that the mayor has taken to try to combat smoking. I'm very, very grateful to the mayor for that. I think all New Yorkers should be grateful to the mayor for that. And the chart bears out what this administration has done. We've been terrific, but we could always do better. We have to take the next common sense things that we need to do. I just jotted down some words from the mayor's remarks and from the commissioner's remarks about smoking, not being a normal behavior. But in order to make it like we really have to denormalize it. This is what it's about. We have to denormalize it, and hiding the cigarettes behind these shrouds and cupboards or whatever will help to do that. We have the science to bear that out. It makes eminent good sense to do so. We should do so immediately. I thank the mayor for that. The mayor also talked about saving lives. I mean, I was at a press conference last week, and he's like, if you're in office and if you're not saving lives, what are you doing? And so this is critically important that we do this. Also, just like a little bit of a nod to what the mayor and I do in another realm. We do a lot of environmental stuff. I'm the chairman of that committee. The mayor is the most progressive environmental mayor in the world. I don't think there's a big debate about that. But we've done a lot of stuff on clean air. And in this administration, by the time all is said and done, this administration will have done the equivalent in terms of clean air progress of taking every motor vehicle of every kind off the streets and then some. That's a really, really big deal, and that's a great health advance for the city. But kids who smoke are not going to get that benefit. We could shut down, we could have a fossil fuel free city, but if you smoke cigarettes, you're going to lose out, and you're going to be as dead as Julius Caesar if you pick up cigarettes, and we can't have that happening. And so while we've made great progress on clean air, and we have a great clean air city, we have to take the next common sense steps that we can take on smoking. We already twice as good as any other city in the country, and that's great. We have half the rate of smokers in the teenage realm, and we got to do better than that. And these good bills will get us there. And I'll end where I began, which is thanking the mayor for his great leadership and thank his great team for putting forward these great measures, which I hope will be passed by the City Council in short order. Thank you very much, Mr. Mayor.
Jim, thank you. We also have Steve Levin, City's Council here. Steve.
Thank you very much. Thank you, Mayor Bloomberg and Commissioner Farley, for your remarkable work thus far in making New York City a city that does not smoke. Thank you, Commissioner Frankel. Your effort, Mr. Mayor, in eliminating smoking from bars and restaurants was truly a global game changer and has saved many lives. And while your efforts to curb adulthood smoking have been valiant, the most important thing we can do as a city is make sure that kids never pick up smoking in the first place. And that's why I'm here today in support of the proposed legislation. Now, I come to this issue with a personal motivation, as I was one of the millions of Americans who started smoking when I was a teenager. Despite my mother's every efforts, by the time I was in my late teens, I was hooked. There is no doubt in my mind that the accessibility of tobacco and the constant advertising by the tobacco industry was the main culprit, and I've learned the hard way that quitting a habit as addictive as smoking is a constant struggle. So if we can take action now so that we can keep just one young person from smoking, then that is a step in the right direction. I fully support these efforts, Mr. Mayor, for sensible tobacco enforcement and pricing that will prevent smoking, promote the health of all New Yorkers, and save lives. Thank you.
Thank you, Steve. With us is Matt Myers, the president of the Campaign for Tobacco-Free Kids. Matt.
Thank you, Mayor. Thank you. It's really an honor to be here. It's rare that one city is a beacon not just for the United States but for the entire globe in tackling a problem as big and as important as tobacco use, which remains the #1 cause of premature preventable death and disease in the United States and around the world. For the past 10 years, New York City has literally led the nation and served as a role model for countries around the globe in fighting tobacco use, particularly among children, with breathtaking success by implementing bold but proven tobacco control measures. With the action today, New York is once again leading the way with bold, but I want to emphasize, proven tobacco control measures. The rate of decline among smoking among New York's adults and children far exceeds the rate of decline in the United States. Therefore, it is rare that a city can say, because of the actions of city government over a decade, New Yorkers have seen their life expectancy increase to over the national average as a direct result of these kinds of measures. However, as Mayor Bloomberg said, New York still has a serious problem to solve. There are still more than 900,000 adult smokers and 19,000 youth smokers. If they continue to smoke, 1/2 of them will die prematurely from death caused by tobacco. Make no mistake, this is about New York City's kids. This legislation will protect New York City's kids. 90% of all smokers start as children. New York's high taxes have had a dramatic effect. But just as New York has responded, the tobacco industry has responded to go after those kids with a vengeance. They've done it by price discounting. They've done it by power walls and powerful displays, which studies show increase the number of kids who purchase tobacco products directly, effectively, and immediately. These two bills will counter the tobacco industry's efforts to continue to reach out to your children. And both bills are based upon sound science, proven programs in the United States and in the case of the display bans around the globe, as Tom Farley had said. Let me just say, the tobacco industry never lets up in pushing its deadly and addictive product on our children. The city of New York can't let up too if it is going to win the battle. New York has been a beacon proving that when we put our mind to it, we can adopt measures that will dramatically decrease the number of our children who become addicted. We have already seen a change in how long New Yorkers live and how healthy New Yorkers are. These bills will make New York a global leader once again. Thank you.
Matt, I couldn't agree more. The most important thing we can do is to stop our kids from smoking. If they smoke as a kid, chances are they're going to smoke as an adult, and that assumes they get to adulthood. Smoking is just, there's nothing good about it, and the tobacco companies, as we know, target children, go to neighborhoods where they're at the bottom end of the economic ladder, and they believe that those people are more susceptible to ads and less able to make the distinctions. It's our job to make sure that they understand that these things are not healthy, and if they care about their kids, any parents, no matter what their economic level is, they will stop and make sure the kids understand and keep the kids from smoking. At this point, let me acknowledge some of the people up here. If each of you just sort of raise your hands. Michael Seelbach from the American Lung Association of the Northeast. Michael, thank you. Dr. Tara Narula of the American Heart Association of New York City. There you are. Deidre Sully of the New York City Coalition for a Smoke-Free City. And Jennifer Podol of the American Cancer Society. Jennifer, there you are. Finally, I would like to ask Julius Wool, the Executive Director of the Queens Hospital Center, to say a few words, and particularly since he's our host, thank you.
Thank you, and good afternoon, and welcome to Queens Hospital Center. It's a great pleasure to welcome all of you and Mayor Michael Bloomberg. I want to thank you on behalf of the staff of Queens Hospital Center for your tireless efforts to improve the public health of all New Yorkers, including your campaigns to reduce obesity and reduce smoking. Today we have with us several of our physician leaders and other staff at Queens who on a daily basis are providing care for patients with acute and chronic diseases such as cancer, hypertension, asthma, heart failure, chronic pulmonary disease, all of which are caused and or worsened by smoking. I want to acknowledge two programs at Queens that have helped reduce smoking. These are the Queens Smoking Cessation Program and the Queens Quits Program. The directors of these programs are with us today as well. Our Smoking Cessation Program, which can be accessed by dialing 718-883-4210, provides education, counseling, and medication to help our patients stop smoking. In 2011 and 2012, the program served approximately 3,200 patients, and of this group, 25% quit smoking. The second program I wish to acknowledge is Queens Quits. Queens Quits is a community outreach program based in the Queens Hospital Center Cancer Center that provides education and support to approximately 50 physician practices and health centers throughout the borough of Queens in their efforts to help their patients stop smoking. Through the New York State Smokers Quit line, which is 1-866-NY-QUITS, the program offers free nicotine replacement therapy to patients. Over the past year, the program has assisted almost 9,000 smokers. On a final note, it is extremely rewarding to learn that Queens County has the lowest smoking rate of all of the boroughs, and I wish to thank all of the staff at Queens Hospital Center and our partners throughout the borough who have contributed to the success. Thank you all for joining us today.
Before taking questions, let me summarize our announcement for Spanish-speaking New Yorkers. Estamos proponiendo las leyes municipales de seña para desalentar a los jóvenes hacia los cigarrillos. Van a restringir los productos de tabaco a las vistas y los mostradores de la mayoría de tiendas y prohibirán la venta de productos de tabaco a precios rebajados. And with that,